Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of MRCP within the last 5 years and want to help you do the same. We are not associated with any MRCP examination organisations, and the materials covered are by no means an exhaustive list of what can come up in your exam, or indeed medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic,
which is dengue fever. So dengue is transmitted through tropical and subtropical regions, especially in Southeast Asia, the Caribbean, Central and South America, and West Africa. And it is transmitted via the mosquito Aedes aegypti, which is found globally. And there's a picture of this particular mosquito just on the right of the video there. This disease is expanding worldwide, with cases described in North America more recently. There are approximately 10 million infections per year globally. Dengue belongs to the family Flaviviridae and is a RNA virus. It's transmitted to humans from infected mosquitoes. The incubation period is usually 5 to 10 days, and the clinical features of dengue usually involve sudden onset fever, a headache which is classically retroorbital, and severe myalgia. There's also a faint, blanching maculopapular rash. The illness usually resolves in 5 to 7 days in most cases. However, in a small proportion of cases, it can lead to hemorrhagic fever, and this is due to bleeding and vascular leak. This severe phenotype is usually in patients who have had previous exposure to dengue. The diagnosis of dengue is usually during the febrile phase with detection through reverse transcriptase PCR or viral culture. Retrospective diagnosis involves paired serologies. Non-specific routine blood tests, including elevated white cell count, low platelet count, and mild derangement of LFTs, are also usually seen. The management of dengue usually involves symptomatic support, with no special barrier precautions required. Viral hemorrhagic fever is a notifiable disease. So let's now try a question. A 22-year-old woman returns from a trip to Southeast Asia and presents to the emergency department with a 4-day history of fever, headache, and joint pain. On examination, she has a petechial rash and her platelet count is 90,000 per millimetre cubed. On day 5, she reports a sudden improvement in her fever, but shortly afterwards, she develops severe abdominal pain and dizziness. What is the most likely explanation for her current symptoms? So our options are development of dengue hemorrhagic fever, resolution of acute dengue fever, superimposed bacterial infection, acute viral hepatitis, or onset of chikungunya fever. So based on what we've discussed in the video, this looks like a classic case of development of hemorrhagic fever. And as we said, this would be a notifiable disease.
Thank you for listening to this episode of Bite-Sized MRCP. If you like what you've heard today, give us a thumbs up and hit the like and subscribe button below to make sure you don't miss our next episode. Let us know in the comments which topics you would like to hear in future. See you in our next episode.